Welcome back. Well, did you know, as a parent, your facial expressions and emotions can have a direct result on the emotional well-being of your child? And joining us once again, we're always happy to have her, is Dr. Alloway, professor of psychology at the University of North Florida and author of 8 books, speaker extraordinaire. It's so good to see you.
Thank you, Casey. Good to be here.
So the kids, we'll talk about what age range. I'm sure as they get older, they understand facial expressions. But starting, I guess, at what age do kids start to realize a smile, be frown, and the meaning behind it?
So a lot of the studies look at children as young as 6 months of age, and they put children in what they call this visual cliff. So like a table, but it's a glass or perspex table, so half of it seems like a drop. And they had the mom on one side, and they encourage the baby to crawl across. And they look to see the mother's expression. If the mother looks fearful or anxious or nervous, the baby, the child, picks up on that fear and doesn't want to crawl across. So as parents, it's really important to know that children mirror our emotions.
So when they're looking at us, how important is it for us to try? I mean, obviously, if there's a situation where they're going to follow the table, you don't want to be all happy.
Definitely not. Or a tarantula on the table.
Or on the guy's shirt. Did you see that?
Okay. I did.
Yeah, that was fun, wasn't it? So anyway, when you're seeing the facial expressions, how important is it for us to try to maintain that, happy smile when we can, even when things in our personal lives are kind of, not in the best of circumstances?
I think it's incredibly important because, I mean, even as adults, we mirror our friends' emotions, our significant others' emotions too. And as infants, they're developing their own emotional framework. And so when they fall and hurt their knee, as parents, we over-dramatize or over-catastrophize that incident, then the children begin to realize that that should be their appropriate emotional response as well.
That is so true. When Madison does something and she falls and it's not that significant, she looks to me to see how I'm reacting, and sometimes I'm like, hey, that was a good one, and she doesn't cry.
Exactly.
So really, for their emotional well-being, to try to, because I think every parent wants their child to grow up happy, right? They want their kids to be happy.
Yes.
So does smiling and trying to force things, that does make an impact, you say, as early as 6 months?
Absolutely. And it also cultivates a sense of emotional resiliency, where if you fall, it's okay, I can get up again. Or if your parent is always making it very dramatic, like, oh my goodness, what happened? And what did you do? Then it's a learned behavior. They begin to think that if something happens where I hurt myself, or, as they get older,
I'm going to freak out.
Exactly.
Okay, so try to maintain your composure to pass that along.
Even if there's a little scrape and there's a little bit of bleeding, don't.
It's okay.
Yeah,
it's all right. We're going to be all right.
That's right.
You say there are some children that you see in your practice, and we're going to give your information away so people can find out how they can get in touch with you if they'd like help with their little ones. But you say anxiety is something that we see in children more and more. So let's talk about how do we notice that they're showing signs of anxiety and what we can do to help with that.
And it's a little tricky because in children, they are not always aware to be able to articulate how they're actually feeling when they feel anxious. So this can often manifest itself as shortness of breath, or them saying that their chest hurts, or even that they don't want to go to school, or some somatic complaints, meaning they complain about tummy aches or legs hurting or arms hurting when there's not an actual physical cause for that pain. So in children, if you're a parent, be mindful of those kinds of symptoms, that if they start complaining about physical ailments without any real reason for that, it could be that they're suffering from some kind of anxiety.
There's some other reason why they might not want to, social anxiety, what have you. You say there's really 3 tips that you have to help them cope. The first, you say, is keeping the anticipatory period short.
Yes. So sometimes we want to cue them up ahead of time. We want to say, in 2 weeks from now, we're going to go see the dentist. And that can create a sense of anxiety. They may remember the last time where maybe it wasn't that pleasant, or they didn't really want that injection at the doctor's office. So keep it short, just maybe the day before or even the morning of, and keep it light. Today we're going, but we're going together. So that can also reduce anxiety, because a lot of times anxiety happens before the event.
It's all the mental buildup, right?
That's right?
And then you go through it. A lot of people come on TV here, they're very nervous, and then after they're done, they're like, that wasn't that bad.
That's right. It's that anticipation.
Yes. Okay. So keep that period short. And can you also say, hey, listen, after we're done with the doctor, we're going to go have fun. We're going to go out and
exactly. So they can have a positive association with that for after the event.
Okay. All right. Another thing you say is important is change the frame.
Yeah. So this is really important. Maybe they have a big exam coming up or something that they're nervous about. Don't ask them, are you nervous, or how nervous are you? Ask them something more broad, like, how are you feeling? So that offers them the opportunity to be positive. Well, I think it'll be okay. Or you can insert that. But if you are already framing it negatively,
a negative connotation, then they are that. Okay, so try to think more on the positive side or generic side.
That's right. Or are you excited that we're going to do this afterwards too? You could frame it that way as well.
Okay, keep positive frame of mind. That's right. Isn't that like life, like trying to keep a positive frame of mind?
Exactly.
Okay. And your third tip, you say, for helping children deal with anxiety, if you're noticing those symptoms, especially young, don't remove the anxiety, teach them to cope.
Yes, and I think as parents, like you're saying, we want to protect them. We want to be able to say, hey, let me take that anxiety for you or that nervousness away from you. But in part, we could be doing them a disservice if we don't actually give them the tools to be able to say, well, when I feel this way, I can identify what's causing that, and I can maybe breathe, or maybe think of something positive, or maybe imagine mom giving me a hug or dad doing something nice for me. So giving them those strategies that they can use independent of you would set them up for, for a healthy life as well.
You have that conversation with them, right? To try to discuss ways that make them feel better. Okay.
Exactly. And you can ask them too, do you like it when you take deep breaths? Or do you like it when we think about our favorite times from the weekend? So you can ask them what they like to think about as well.
Okay. All good information. By the way, I'm going to give your phone number in a second, but if parents do have questions about their children, they can come and see you.
That's right. I do gifted evaluations. We look at children if parents are concerned about ADHD, anxiety, autism. I'd love to be able to work with your children.
But even like if they want to come and see you just from, hey, I just want to get some perspective on how I should best raise my children given your expertise. Can you do that?
Absolutely.
Okay. All right, just throwing that out there. It's good to see you. I want to give your phone number for more information. If you'd like to get in touch with Dr. Alloway, the number is on the bottom of your screen. She's over at the Florida Psychological Clinic, and that number is 904-277-0027. We will be right back.